So my brief is to develop a mental health strategy and action plan. That will be public. It will be from Minister Sacramento, who's tasked me with doing this, so it will be published through the Ministry of Health and be made public. So that will be a transparent step one. Part of that process then will be working groups, multidisciplinary groups. Part of that is about getting patient involvement, as well as the wider system, NGOs, other partners across the system engaged and involved in how we take that forward. So that transparency will be happening. If you're talking about job descriptions or other types of things, that's something we want to work to. So again, recruitment is transparent, open. So they're all the kind of steps we want to take going forward, again, guidelines, policies, to have that transparency.
And I'm looking at a specific example, an issue that I think that was raised by Maulana Hassan on recently. There still seems to be a lack of information, a lack of clear pathways for service users experiencing a mental health crisis, or at some points at which they need service and it's not immediately clear where they should go to. Is this something that you envisage being dealt with in the foreseeable future?
Yes, absolutely. So it's been identified by our stakeholders that is a priority. So when we did that workshop in December, on Monday the 22nd of this month, we're having a key meeting to look at the adult mental health care pathway as a starter. There'll be others to come following that. But that's a first step where we're trying to think about exactly where patients fall, where they go in the system, at what criteria or mental health problem where they should be treated. So yes, it's absolutely a priority that we make sure that's clear for patients but also staff across the system, so they know where to refer and where the support will be, how long that referral process is going to take, the assessment, all of that needs to be captured, as well as encouraging that recovery, rehabilitation, so that patients are, where possible, in the community, in their homes as much as possible.
And just to close, do you think that this is going to encompass the collection of more data, of moving towards having care plans perhaps more specifically tailored to service users?
Yes, I very much hope so. So very much, again, an objective will be about making sure the patient is at the heart of all those decisions, that they are empowered to be part of their care plans and what works for them, that it's a holistic package, that's all part of the long-term vision and goal, that they are part of that.